Continuing fentanyl crisis in Wichita now forcing city leaders to look at moving more liquor tax funds toward an alcohol and substance abuse prevention and treatment program.
12 News reporter Brock Wilson has the details about how the additional resources will be used to help people get the treatment they need.
It's several steps that the city funds to help people beat their substance abuse problems.
Wichita Municipal Court Administrator Nathan Emery says the city has a plan to reallocate over $400,000 from the liquor tax toward the prevention and treatment program.
Because of the rise of fentanyl in our community, we're seeing a greater need for people to have access to the continuum of care in our court system.
That's where DECA, a community services organization, steps in, providing care to those patients.
Access to medical, physical health care, mental health care, as well as medication-assisted treatment.
Donna Gorman with DECA says because of the funding the city is providing, they're able to give people life-saving treatment they wouldn't otherwise receive.
Our residential treatment program overall, I would say, is likely at a 75 to 80% success rate.
This will also increase the capacity for the inpatient treatment program to up to 60 beds. But the city says the hope is that those extra beds will not be needed.
Hopefully we don't reach the total dollar amount capacity, because that means that the need isn't there in our community.
DECA says the program not only puts people on the road to recovery, but also helps them rebuild.
It's very comprehensive. And so when folks come in here for residential treatment, it's not just groups, but they're getting other services as well to help them rebuild their lives.
In Wichita, Brock Wilson, 12 News.
Donna says she thinks the reason why fentanyl is so much of a problem right now is because it's cheap and very addictive. The reallocation of money is expected to pass at next Tuesday's City Council meeting. Once that happens, DECA's contract will be renewed and they will immediately have the ability to treat more people.